Bore da pawb, good morning. Thank you for taking time out to join us today. I think this is a very exciting venture and probably something that wouldn't have occurred if we hadn't had the circumstances that we've had over the past 9 months. So we've been engaged in lots of different and novel ways of working. Karen mentioned the word innovation. I think that as well as 2020 being remembered the year of COVID, is probably the year of innovation. It was the year, for the first full year really, since I was appointed. I was appointed to this role in the summer of 2019. What wasn't in the job description was having to chair AWMSG as we went through a pandemic, but I don't suppose it was in anyone's job description either. If we can go to the next slide, please, thank you. I was fortunate enough to be one of the original members of AWMSG way back in the year 2002. And what I've been able to observe is what has been achieved during the 18 or so years since its inception, in terms of the guidance, the appraisals, reviews, the policies and strategies, and probably the most important thing is the level of expertise and intelligence. AWMSG has developed an infrastructure which I think is highly capable and commendable in terms of the expertise that it contained within the organization and the volume and the relevance of data and the intelligence which is drawn from it. One of the first things I had to do was to reflect on where AWMSG, AWTTC had arrived at. So next slide, please. I was issued with a remit letter from the Minister, and I'll come back to that in a moment. It was obvious that the role and number of appraisals was declining for a number of reasons. I can remember spending, during the, I suppose, the height of the appraisal season in AWMSG, spending hours upon hours in the Angel Hotel in Abergavenny, going through, I think it was 6 or 7 on occasions, which we had to deal with in a day. And I also remember the NMG meetings which emerged, where we were doing the actual appraisal in far more detail. So I've been there at the appraisal phase, but it was apparent that because of what NICE was proposing, because of the way in which health technology assessment has evolved, the appraisals were not as numerous as they had been. We were also in a position where NHS Wales faced a number of issues. And remember, this is pre-COVID. Those issues in many senses have remained, except they've now been multiplied by the consequences of coronavirus. So I also took time to talk to the various stakeholders around Wales to get their perspective and their take on where AWMSG, where AWTTC was and where it needed to be. We needed to develop the strategy and a work program to reflect the changing circumstances, the changing climate, and the changing arena surrounding medicines management. And also, it was apparent that, and the external review of AWMSG highlighted this, that we needed to perhaps re-engage and get more aligned with the health boards and their particular strategies and policies regarding medicines management. So the next slide, please. So back to this remit letter. The Minister gave me 3 basic strategic goals. delivering better outcome for patients, reducing harm and improving medication safety, and supporting the delivery of value-based healthcare. These are obviously key goals, and no one would have any objections to them. They, however, do give us a sense of direction of travel, and it's been noticeable that since being appointed as chair, that these goals have been given to me by a number of people, not just the minister, because AWMSG needs to ensure that we deliver better outcomes for patients. We know that in Wales, the population is less healthy than it is in other parts of the UK. We know that we can improve medication safety, and there are a number of examples of attempts to do that. And the buzzword, in a sense, within health policy in Wales has become this notion of value-based healthcare. And value is obviously in the eye of the beholder, but it's not just looking about costs, it's not just looking about outcomes, it's looking at the both together and ensuring that we are getting the best bang for our bucks in relation to where we put resources, which are limited, and as we know, they're extremely limited. So that's my my roadmap, as it were, the guiding light. That's what I've got to achieve. That's what I'm accountable to the minister for. So if we go to the next slide, please. This is a sort of an outline of the various stakeholders and subgroups which AWMSG relates to. Karen mentioned the relationship with NICE. That is evolving because both AWMSG and NICE are evolving themselves. We were closely aligned with NICE and still are closely aligned with NICE. We regularly have conversations with NICE's person on the ground in Wales, Julie Vile. We're developing a revised memorandum of understanding. Karen has alluded to the fact that we were co-hosting with NICE HTAI in 2021. We have regular communication with colleagues in NICE and indeed in Scotland. The subgroups of AWMSG and OPAG, NMG, I am kept out of jail by colleagues in AWTTC who keep me on the straight and narrow. I also have regular meetings with Welsh Government and, I'm glad to say, with ABPI, and those have continued despite not being able to meet in Cardiff Bay. We've done them virtually with ABPI, and they've been very helpful in cementing that relationship. And obviously we have close links with patients and the public and through our lay representatives, and we're working hard to ensure that that is further developed. Thanks very much. So if we can turn to the next slide. The key objectives of AWMSG over the next year or so are to shape the medicine management agenda in Wales and implement AWMSG's prescribing strategy. That means that we will be providing strategic direction to the NHS in Wales in regard to medicines management. What has been apparent during the COVID period is the way in which health boards have now engaged with AWMSG, and AWMSG is engaged with the health boards. One of the feedbacks that I had from chief pharmacists and the health board medical directors was that there was a sense that AWMSG was not as relevant as it perhaps should be vis-a-vis the health boards. So we agreed to do a road tour of Wales. Now that road tour of Wales was agreed probably when the first case of COVID-19 hit the UK. And so it became apparent that we would not be able to get around Wales. We had decided to visit each of the health boards and offer opportunity for relevant representatives of health boards to attend and to participate and to offer their views as regards medicines management in their particular community and localities. What we've managed to do through AWMSG is to do that, but do it virtually. So we, I think, are in a position whereby we provide national guidance, but within a local context. And I think these partnerships in and of themselves are innovative, and they will benefit patients in local communities. What we want to do as well is to achieve the best outcomes from the use of medicines in Wales. So we are keen that the prescribing indicators are used not as the stick to beat people up, but rather as the driver of conversations, so that we can work together to ensure that best outcomes are achieved. If the indicators are meant to be evidence-based indicators of good practice, then we want to work together to actually ensure that where we get good practice, that is replicated, and where we need to improve practice, then we can do that in a collaborative way. Next slide, please. So in 2020, obviously, we saw the next COVID and coronavirus hit the streets in a big and way in which no one had envisaged. And, you know, Confucius didn't really know what he was saying, I think, when he said we live in interesting times. Next slide, please. What AWMSG has managed to do in 2020 is in many senses remarkable. Up until February, March 2020, I thought Zoom was a lollipop. Now it is a feature of everyday working life. Other virtual facilities are available. I know some people use Teams and Skype and so on, but we did manage to hold 7 meetings during 2020, 6 of which were held virtually, and we did have health board involvement in those. And we have now visited an Irene Bevan Health Board, Comtaf Health Board, Betsy Cadwallader Health Board, Hywel Dda Health Board, Swansea Bay Health Board. We had intended visiting Cardiff and Vale, but that was not possible. So we nearly got around Wales. We've still got a few to visit, but at the same time, a number of publications and resources have been made available to the service. And what has been interesting is the way in which the publications and the resources have been reallocated to tie in with the impact of the coronavirus pandemic. We have continued to monitor the national prescribing indicators, and that is an ongoing piece of work, and that's something we are keen to develop as part of the work programme. I mentioned that it is something to inform conversations. We have got the colour chart at the beginning of the indicators, and they are useful, but only to start the conversations. They're not in any way designed to beat people up. We've undertaken 14 appraisals during the course of the year, and 93% of those have been recommended. And we've also continued to monitor the new treatment fund. Specifically, next slide, please, in regard to COVID and the developments that have taken place. Obviously, we had to suspend what was called non-urgent work, and we suspended the meetings during the early phase of the pandemic. We have reinstigated those meetings, as I said, and made them virtual. But there has been considerable communication and information sharing, and what we're also in the process of developing, and both Steph and Karen alluded to this, is the communication and engagement strategy. And there are some examples of what has been developed during the course of the pandemic, what we've been monitoring during this period of time, and also what we managed to do in order to ensure that things are not delayed because of perhaps processes which may be regarded as clunky. We have responded where necessary to Welsh Government and to other requests for access to be made available. So that is credit to the team in AWTTC for making these things happen in real time, as it were. And I do want to congratulate and thank them for the way in which they have been prepared to see things from a different perspective and to ensure that the service is briefed, the service is provided with evidence and information which has helped in not just the management of COVID and obviously patients suffering from COVID, but with regard to other issues which needed to be addressed during this particular time. What we've also seen are a number of other developments, and if I can have the next slide, please. The new website was launched in the summer. That was quite an achievement. In the December meeting of AWMSG, we reviewed the process for appraising paediatric license extensions, and that was approved. I've mentioned the health board representatives, and this is the first of the virtual masterclass. I think that these are exciting opportunities for both AWTTC and industry to work together to see how we can learn from each other and develop a strategy and policies which will fit in with those 3 goals within the remit letter. We're also in the process of progressing a disinvestment proposal. I don't personally like the word disinvestment, but it's more or less a reallocation of resources to ensure that we deliver the best possible outcomes. A plain language document is published on the AWMSG website. That's as much for me as anyone else, because what I haven't still been able to do, and I never have, is to be able to pronounce some of the terms which therapies seem to hit the streets with. What the other thing is important is complying with Welsh language requirements, and this is a key aspect of the ongoing work programme. Next slide, please. So in terms of future priorities, we are going to continue our alignment with NICE. We are working to ensure that our inputs to NICE regarding the review of methodologies and prescribing guidance are aligned. That's not to say that we're not going to see where there are differences which need to be in place because of the situation in Wales, because of the system in Wales, because of the circumstances, that we will provide slightly different advice where necessary. We're also supporting the implementation of the BlueTech high-cost drugs platform and improving access to advanced therapy medicinal products. We're continuing to provide up-to-date timely advice on new medicines and also medicines of low value. You're going to hear a lot about that and stakeholder partner engagement in the course of this particular masterclass. And Karen has mentioned, AWMSG not just goes local and around Wales, but goes global by co-hosting the 2021 HTAI conference. I'm going to leave it there. Thank you very much again